So today we're just gonna do a quick sort of session on medical ethics. So just looking at what medical ethics is. So medical ethics obviously describes the moral principles that a doctor sort of needs to conduct themselves, but it's sort of worth noting that medical ethics is like a change in ideal. So what was ethical 30 years ago isn't necessarily ethical now, and what's ethical now might not be ethical in the next 30 years. Can anyone think of any examples of things that you think could have been ethical 30 years ago, but isn't ethical now?
Cloning.
Sorry?
Like cloning animals.
Yeah, in what sort of sense? Do you want to expand a bit more on that?
Or like the idea of cloning human beings. Like today I had biology and I was doing Dolly the sheep and how they cloned that sheep, and they were like, they've realized that it's not ethically right to think about cloning human beings.
Yeah, that's
so maybe like a couple years before they would have thought it might have been okay.
Yeah, that's a good example. Anyone else can think of anything else?
Lobotomies.
Sorry?
Lobotomies, like cutting off half the brain.
Yeah, exactly. That was something that obviously even leading on to like psychiatric conditions, where if you came in with like, mental illness and hysteria, they'd like strap you down and force treatment. And that's obviously something that's not being done again now. Yeah, that's a good one. Anything else? No, but I think most of it, you have covered most of the sort of like research studies. So now when, for example, like the COVID vaccine, they were doing it for trials, you have to get people's consent before you obviously start testing stuff on them. Whereas beforehand, they could just get random groups of people and just start testing medications and drugs on them. And that was completely ethical. But obviously now they've come up with the rules that you have to follow as to what to do before you start testing any sort of products on anyone. So within medical ethics, we sort of think about it in sort of four different, they're called pillars. So you've got four different pillars, and we'll just briefly go through it. And obviously we can't cover it all in this session, but hopefully in the 2-day session over the summer, we can sort of go into more detail about it. But yeah, so these are the four pillars. So you've got autonomy, beneficence, non-maleficence, and justice. So I'll just do a quick run through of them. So autonomy means that you give a patient the right to choose what's good for them. And that sort of means that, when someone comes to you and say, oh, I've got a headache, and you say, okay, I'm going to prescribe paracetamol, the patient has a right to decline that and say, you know what, I don't want to take the paracetamol, and you can't force them to take the paracetamol. Say if someone came into hospital and needed surgery, and you tell them, oh, to save your life, you need to have this emergency surgery, it's useful, and they say, no, I don't want it, then they don't want it. You can't force it on them. Whereas beforehand, that could have been something that you'd say, I'm saving your life, you're going to get that surgery. So unless someone don't have capacity, so if they've got, for example, conditions like dementia, or they're really young and their parents can make decisions for them, you let someone choose their own treatment and how they want to be treated. The next one is beneficence, which means that you do good and you always promote the patient's best interests. So again, it's the fact that you see someone, they're ill, you tell them these are the best treatment for you, but again, that person could decline it. But it's always the fact that whatever you do, you always need to make sure that you're doing it in the best interest of that patient. And the next bit, you've got non-maleficence, which basically is one of the key, I think when you hear about medicine, they always go, do no harm. And that's basically what that means, that, you need to make sure that whatever you do, you don't cause harm to someone. And obviously, sometimes you can end up causing harm whilst trying to treat someone. So say in surgeries, when you do an operation on someone, somehow it might end up that you end up, damaging an organ on purpose, or you end up giving them an infection, but that wasn't on purpose. So non-maleficent means that the core aim of whatever you're doing is that you're trying to not cause harm to someone. And the last bit is justice, which sort of talks about ensuring that all patients are treated equally and fairly. So you can't have people that you're going to treat them better because they're your friend's mum, or they're your friend's sister, or, you saw them down the street, or they look really nice. So, you have to treat them nice, or someone doesn't look nice, so you're not going to treat them nice. You have to treat everyone the same.